I'm Afrayem. I'm an addiction medicine specialist and a psychiatrist with Atrium Health Behavioral Health. I like to think of addictions, particularly substance use disorders, as disorders of learned behavior rather than a biological organic disease. There's a lot of studies and a lot of literature out there, particularly in the functional neuroimaging space, that correlates of addiction, of the learned behavior of addiction, are observed in the brain. The same goes for any learned behavior, whether it's functional or dysfunctional. We do see correlates in the brain that go with that learned behavior. That's why I say no, it's not a brain disease per se. One of the best ways we know to destigmatize addiction and mental health concerns in general is contact-based, person-centered approaches. And that is essentially humanizing the condition. After the decade of the brain between 1990 and 2000, a lot of literature came out on educating people as to the biological roots of these diseases, addiction or mental health. When public health research was done on the effect of that education on stigma, after 10 years of public health messaging, it was found that stigma was at least the same, if not worse, after the brain disease messaging or the biological messaging about these conditions. More follow-up found out that when we humanize these conditions and we introduce the layperson to people in recovery or to peers who are in recovery and are actually doing work in the mental health and addiction space, that was one of the most effective ways to destigmatize addiction and stream. My primary specialty is psychiatry, and we do offer dual diagnosis management, particularly in the outpatient setting, so long-term management of mental health conditions, whether it is somebody that needs to receive medications for their mental health conditions or somebody that has been over-medicated because of previous diagnoses of mental health conditions. One of our goals is to make sure that patients are on the least number of necessary psychotropics with our practice. We also work on the other side with Dr. Pierre. She works with infectious diseases. Her background is internal medicine. I think we cover lots of bases in our practice here.